Almost a quarter of patients discharged at a hospital return for a repeat visit within 30 days. But patients who have a clear understanding of their post-care instructions are 30% less likely of readmission than those who lack this information, according to a different study. These two statistics together point out that although patients benefit quite a bit from clear yet descriptive post-care instructions, they're hardly ever given to them. In other words, even though patient education could largely save hospitals and practices from readmissions, it's an area that's not really emphasized. I get it. Healthcare organizations have 1,000 priorities and many of them pop up out of thin air when administering care or determining a diagnosis. When this happens, patient education materials get pushed aside, and that's understandable. But maybe it isn't a matter of priorities at all. Patient education may not happen as much as it should because healthcare employees don't know how to create effective materials. Hi everyone, I'm Matt from eTactics, and today I'm going to tell you 4 things to keep in mind when creating patient education materials. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit the alert bell icon next to it as well so that when we post new helpful content, you get notified. The first thing you need to keep in mind when you're trying to create effective patient education materials starts before you've even begin to think about designing. You need to write copy. You're a doctor or a healthcare professional, so you're smart. You've likely written a few college research papers in your day. However, when you're writing your copy for anything that's patient-facing, you need to make sure that it's understandable and simple. All of your clients come from different backgrounds. They have different interests, opinions, jobs, and education levels from one another. You'll need to keep all of these in mind when you're writing copy. I'm not saying you need to create multiple versions of your materials to cater to the different education levels of your patients. That would require you to have at least 20 different versions and ask each person what their education level is before giving them the material for them. This is both silly and embarrassing. Instead, use language in your copy that everyone can understand. That way, you only need one master version. A good rule of thumb here is to reference the golden rule of writing for the general public. Aim for an 8th to 10th grade reading level. Now that copy is out of the way, let's start talking about design. The second thing to keep in mind is to use modern templates when designing. Do you remember the 3D guy people used to put on every piece of content their company ever produced? If you're still using him, you need to revamp your designs. This guy was very popular in the early 2000s, and no one liked him back then, so your patients definitely don't like them right now. When you place an emphasis on all the different elements of design, you're accomplishing 2 things. First, you're making your patient education materials better looking, which increases your brand perception. Second, you're also making it easier for your patients to remember. Robert E. Horn, a Stanford researcher, reiterated how design impacts comprehension. Visual language has the potential for increasing human bandwidth, the capacity to take in, comprehend, and more efficiently synthesize large amounts of new information. So spend some extra time researching modern design themes and templates and trends before you get started, so that way you can spur your own creativity. Our third tip for creating effective patient education materials is to add graphics for emphasis. We're all visual learners in some capacity. In fact, when a message and a visual exist together in the same page, people can recall 65% more of the information 3 days later. But similar to the section I just talked about, you need to make sure that the graphics you include are well designed. If you use graphics or charts, they need to make sense. If you throw in a graph or a chart just for the heck of it, it won't end up having any context and be very confusing for your readers. Don't force graphics and charts into your design because I'm telling you to add them. Instead, add them to your material only if they reinforce your point and make sense for your data that you have. Our final tip for you is to transfer your finished education material across different platforms. Way before a movie hits the big screen, there needs to be a script behind it. Oftentimes, writers adapt those scripts from a book originally written by an author. The point I'm trying to make is that everything starts with writing. Now, after you finish writing and designing your first round of patient education materials, you don't want to throw away or delete the text file containing your original copy. Instead, take that copy and turn it into a script for a video, maybe a colorful infographic, or an image for social media. By transforming your material into different forms of content, you're catering to different patient demographics and reaching a larger audience. By investing some time and energy into making materials that will help your patients understand their ailment, treatment plan, or prescription, it will not only save you time and money in the long run, it'll reduce their chances of readmission tremendously. If you'd like to learn more about what to keep in mind and tools to use when creating patient education materials, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below. Well, what are you waiting for? Subscribe to our YouTube channel.